It is one of the most common causes of deadly heart attacks. The heart is forced to work harder, to strain, as blood flow is restricted due to blocked or clogged coronary arteries.
The narrowing that occurs with coronary disease is due to cholesterol buildup in the arteries themselves, which produce narrowing. It accounts for heart attacks, sudden death, and a fair number of patients who have disabling symptoms of what's called angina pectoris, which is recurring chest pain, particularly with exertion.
To avoid the invasive and complicated procedure of coronary bypass surgery, the most common method doctors use to unblock coronary arteries is an angioplasty, a procedure that opens a clogged artery with a balloon-like device and then attempts to keep it open with a wire mesh called a stent.
A stent is a scaffolding that is placed inside the coronary artery and holds it widely open. It's not a perfect device in the sense that it doesn't necessarily keep it open.
In fact, more often than not, the results achieved through angioplasty are temporary. Arteries can become reblocked due to scar tissue that forms around the stent. The FDA has recently approved a device that uses small doses of radiation delivered directly to the stent site to prevent this type of restenosis. Dr. Douglas and his team are using the system, designed by engineers with Novoste, during most of the angioplasty procedures being performed here at Emory University Hospital.
The idea of using radiation to prevent restenosis grew out of the understanding that restenosis was a proliferative condition, and radiation has been used historically for many years to prevent proliferation or excess proliferation of tissues. We worked with the National Institute of Standards and Technology to very carefully calibrate the radioactive seeds that are part of this treatment device. And once we knew what the dose rate from those seeds are, then we could prescribe the intended dose and deliver it with a high degree of accuracy.
A gentleman who is an avid tennis player who couldn't play tennis, eventually had to give it up because of this repetitive re-narrowing of a stent. We treated him with radiation. He's back on the tennis court doing extremely well. So it's quite gratifying when that technology is available.
Not long ago, major surgery was one of the only choices available to treat killers like coronary heart disease. The introduction of new techniques allows doctors to keep their patients' options as well as their blood vessels open.